Abortion law regulates the availability of abortion by permitting, prohibiting, or restricting the procedure. Abortion has been a controversial subject in many societies through history on religious, moral, and ethical grounds. The Due Process Clause of the 14th Amendment in the U.S. Constitution provides a right to privacy that protects a pregnant woman's liberty to choose whether or not to have an abortion. Because of the 14th Amendment, in 1973, Roe v. Wade ruled that banning abortion is unconstitutional. Recently, a number of states have challenged Roe v. Wade, and its circumstances vary by state. Some states have already implemented these laws, while others have not. If the current bills are passed, these are the following changes that will be made. In the states of Georgia, Kentucky, Louisiana, Mississippi, and Ohio, abortion will be illegal after a heartbeat has been detected. In the states of Arkansas and Utah, abortion will be illegal after 18 weeks. In the state of Alabama, abortion will always be illegal, no matter the circumstances.
Although no abortion ban has gone into effect, it can have some of the following societal impact. Number 1, there will be more unwanted births, which could potentially raise the amount of children given up for adoption. Number 2, it will reinforce income inequality. Medicaid will not cover an abortion unless the woman is in danger or the pregnancy resulted from rape or incest. Women with low income and who cannot afford abortions without Medicaid funding will also struggle to afford to raise a child. And number 3, companies who are opposed to the bill may potentially pull their businesses from states who passed the bill. This can have a huge economic impact. For example, Netflix, Disney, NBC Universal, and CBS Corporation and its Showtime subsidiary have all threatened to pull their business from Georgia. The film and TV industry is responsible for more than 92,000 jobs and nearly $4.6 billion in total wages in Georgia, including indirect jobs and wages according to the Motion Picture Association of America, a trade group.
The procedure for abortions in the U.S. are extremely safe. According to extensive documentations, abortions in the U.S. are safer than having your wisdom teeth removed. The restrictions included in the new laws will risk the health and safety of many women. Due to the removal of safe procedures, women will turn to less effective and more dangerous methods. This includes taking herbs and inflicting abdominal trauma. Women's emotional and physical health will be targeted by these laws. Unnecessary abortion restrictions will result in unequal access for women. The expense of abortion care is already very high for some women of lower socioeconomic status. These types of restrictions may unfairly make it accessible to only the wealthy. This contributes to an increase in the socioeconomic gap.
Imagine being undocumented and considering self-managed abortion in this environment. How are immigrant women affected by the U.S. abortion law? Since Roe v. Wade was decided in 1973, states have made several restrictions to accessing abortion, causing widespread clinic closures and significant barriers to accessing abortion care. This has affected women of color, immigrant women, and low-income women. Self-managed abortion can be an ideal option for immigrant women currently in the crosshairs of the Trump administration's anti-immigrant, anti-choice administration. But the risk of imprisonment is especially high for the low-income women of color who obtain abortion medication through illegal means. Although there is little to no data on arrests of undocumented women tied to self-induced abortions in the U.S., the National Latina Institute for Reproductive Health Executive Director, Jessica Gonzalez Rojas, told Rewire.News that undocumented immigrants are absolutely more criminalized and fundamentally experience the criminal justice system differently. The November 2018 report from the Guttmacher Institute only confirmed what immigrant communities in the U.S. already know. Immigrant women face significant challenges obtaining comprehensive and affordable health insurance coverage and care, including sexual and reproductive health services, compared with the U.S.-born women, because of numerous policy and systematic factors. Abortion access in immigration detention centers is especially limited. Detained immigrant women are in a uniquely difficult position because A, they're being held by the government, and B, they might not be familiar with the American laws surrounding the procedure. Guttmacher also added that there is no research on the characteristics of immigrant women who seek the abortion services. González Rojas said that even less is known about the undocumented immigrants who choose to self-manage their abortion. Part of the problem is where the data is collected, which is often at clinics after a person has self-induced and the approach was either unsuccessful or they weren't sure. It can be difficult to research the immigrant population in order to gain a better perspective on their needs, because many of the clinics are already out of reach for the undocumented communities, and there is a lot of fear around accessing health care and health services. It's generally difficult to get undocumented people as research studies because of numerous barriers, and immigrant communities may not feel safe being part of studies if they don't know how the information will be used, if it will be used against them, or if it may harm their ability to remain in the U.S. There is a lot of legitimate fear, but sadly, this also means that the data is not being collected and their needs aren't understood. Immigrants, especially undocumented immigrants, have to grapple with a double dose of fear seeking medical care because of instances in which people attempting to access medical care were instead turned over to ICE. Times have changed dramatically since the pre-Roe versus Wade era, when self-managed abortion was quite dangerous. Sadly, self-managing might feel like the only option for people who experience barriers accessing abortion in a clinic, like fear surrounding deportation. As immigrant women, you must take precautions whether you decide to take your pregnancy to full term or not. Nowadays, there is so much information regarding pregnancies, be it online or at a clinic.
Possible solutions to the issue include voting for people who support women's rights, including their right of having an abortion, and other decisions according to their reproductive system. Another way is to test the boundaries of court protections for abortion in creative ways. For example, conducting research on prior laws that have successfully fought against similar issues dealing with abortion, both in the U.S. and other countries, may help create a stronger case. Advocating for women's rights in legal ways, such as creating and attending marches that will spread awareness of this vital issue, establishing alliances with stakeholders that are for women's reproductive rights, and taking the initiative to do community outreach by doing things such as developing informational workshops on the issue and how this law is interfering with women's rights overall, including females of all ages and cultures.
Parenthood Planning is an organization that has been around for many years. It is an organization that allows women to get pregnancy tests, STD testings, as well as HIV and AIDS testing. It is an organization that provides information to women if they were to be pregnant. It gives them information on how to take care of themselves during their pregnancy, as well as other prenatal information. It also provides women with information on abortion. It gives them the pros and cons of an abortion and how the procedure goes for an abortion. This organization gives women empowerment in their own body and lets women decide what they want to do according to their situation.